I'd like to introduce you to an all-new education module focusing on the role of the bedside nurse in infection prevention. This course meets the needs of nurses by providing concise explanations and strategies that will help them handle their daily nursing responsibilities in this era of national focus on hospital-acquired infection prevention. I'm Wendy Kaler, and along with my partner, Shabnam Hashemi, we've combined more than 20 years of hospital infection control experience into developing this course. We created this course especially for those entering the field of nursing to raise their infection control consciousness at an early stage of their career. We've been teaching this course in nursing schools and as continuing education to bedside nurses over the past 2 years and have received very positive feedback. We wanted to make it available to a wider audience of nurses, so we've created this online module. Who should view this module? Nursing students, bedside nurses, and any allied health professionals who are working in the hospital setting. Why this video module? Because so much has changed in the world of infection risk and prevention in the past decade. Because infection prevention is a focus of every state and national healthcare regulator. Because this course can be assigned to be completed outside of scheduled classroom time. Why a comprehensive infection prevention course? Because nurses play a vital role in reducing risk for infections in their patients. Nurses are not currently taught this information in nursing school. There are new evidence-based guidelines in infection prevention. There are recent changes to national and state infection control requirements for accreditation. There's a decrease in Medicare reimbursement by CMS for patients with healthcare-acquired infections. There is currently mandated public infection rate reporting in many states. Here are a few comments from those who have attended these lectures. The format includes video lecture with synchronized PowerPoint slides. Here's the outline of the topics that are covered in Part 1. Here are the topics that are covered in Part 2. The module can be assigned to each student to be completed outside of regularly scheduled classroom time. It can be divided into Part 1 and Part 2 to be assigned based on the semester of nursing school. For nurses employed by hospitals, it can be used to provide CEUs. The education module can be accessed by going to the website for infectioncontrol.digitalchalk.com. Here are some excerpts from the actual lecture module.
Everybody's role in the infection control program in a hospital is to protect yourself and to protect the patients. And the way that that is done is with some very clear-cut practices. It's not very fancy, but it just needs to be done, and people need to focus on that. And I think that's probably over the years been the biggest problem, is that people get busy, and nursing staff get very busy with all of the tasks that are on their plate, and they cut corners, and they don't necessarily realize that what they're doing might have a bad outcome and might be involved in the transmission of an infection in their patient. So practice your infection control in front of the patient. Clean your hands in front of the patient. Pop up a fresh pair of gloves in front of the patient. Don't come into the room wearing a pair of gloves. Makes patients very nervous. They don't know where those gloves have been. Always pop up a fresh pair of gloves in front of the patient. And if you're going to clean a piece of equipment before you use it on a patient, clean it in front of them or their family members and say what you're doing. You instill great confidence in them if you say what you're doing. Tell them you're cleaning this. Everybody knows what that looks like. So it really helps them to feel like you're focused on their safety if you do that in front of them. And I just want you to remember every day when you're on the job, when you're in the hospital and you're working and you're doing all of your roles in nursing, that you stop and you say, you know, knowing my current use of infection control practices, hand hygiene, cleaning environment, would I feel comfortable and would I feel safe if I were my own patient? Am I good enough with my nursing skills and my infection control and my patient safety to be my own nurse? Because ultimately that's where we're all going. Ultimately we're all going to be patients. And all of us who are trained and educated know what to look for. And I think we all need to realize that that could be us in that bed. And are we good enough at our practices to be our own nurse? Patients and, well, people in general, people have organisms all over our bodies. I think everybody's aware of that. There's good bacteria and bad bacteria. There's regular flora on our bodies, and then there's pathogenic bacteria, which is what we're concerned about in the field of infectious diseases, are those things that cause infection, the pathogens. But everybody has organisms on their body, and what's important to know is that just because you get a lab result back and the lab calls you or you see a written result that there's something growing from the patient does not mean the patient is infected. And I think this is a very difficult concept for a lot of people to understand. All that the lab can tell you is that the organism is there or it's not there. The question is that organism responsible for the patient's symptoms? Is that organism actually causing an infection and symptomatology that needs to be treated? Because just because the lab report comes back as growing an organism does not mean that organism needs to be treated or that patient has got a problem with it. So it's important to know which parts of the body have what types of organisms naturally. And we have different...
The cost for Part 1 is $24.99 for 2 hours of lecture and exam material. The cost for Part 2 is $24.99 for 2 hours of lecture and exam material. The students pay their fee when they sign on to the course website. They receive a certificate of completion after they complete the course exams. This certificate can be submitted to the instructor or the hospital continuing education office. For those who need nursing CEUs, we provide our CVs on our website at www.infectioncontrolexperts.com. We provide a list of objectives for those who need to provide CEUs.